Hello, good afternoon. I am Dr. Arun Bal. I am a consultant diabetic foot surgeon in Raheja Hospital. I want to specifically, guide the patients of diabetes, especially in the monsoon, who have a long-standing diabetes and who have a neuropathy. Neuropathy means those who have a long-standing diabetes, their nerves reduce the function or sometimes stop the function, so they lose the sensation in the feet. And most of the people in India wear the footwear which is commercially available, but many times that is not suitable for the patients. It is very important to take care of feet. Recently published statistics from American Diabetic Association says that India has 100 million diabetic patients, so you have 200 million feet to look after. Now that's a huge number, and every patient has to take his own care. You cannot depend on the doctors in hospitals. They may be available in the country, in the bigger cities or second level cities, but in a lower number of cities and in taluk place, district place, there are not facilities. But if you are a diabetic of more than 3 to 4 years, you need to check your feet regularly. You need to check for the nerve function. You need to check for the blood supply. And then if there is a problem in the nerve function, then you need to take extreme care of your feet. Barefoot walking is the commonest cause of the problems in the feet, especially in the monsoon. Now, when your people are walking, traveling in the train, there are flooding of the roads. There are roadblocks. So at that time, if you are wearing, for example, closed shoes, then you will find that your socks become wet, and the whole foot remains wet for hours together. A wet skin of any patient's feet will be a problem because there is no function, or it is reduced function, so the skin easily breaks. In between the toes, the skin remains wet and it catches the fungus infection. Now the fungus infection usually causes in a non-diabetic patient a lot of itching, redness, pain. That doesn't happen in a diabetic patient when the nerves are not functioning. So the patients are not aware that there is a fungal infection. And in that case, it remains neglected, and suddenly one day you find there is a problem in the toe, either there is a blister or a pus, but that is too late. At that time, patient requires sophisticated investigation, patient requires surgery. Many patients land up with amputation of toes. In fact, one of the commonest cause of amputation of the toes in India is a web space fungal infection. So the simple care is to carry a separate set of socks with you when you go out or when you go for work. At the work, when you reach, you can clean the feet and wipe the web space with sanitizer. So it is important not only to clean but remove the moisture, because if you remove the moisture, then only fungal infection will not occur. See, every fungal infection has three components: the fungus, the environment, which is usually moisture, and the host, which is the patient. And host is already immunocompromised because of a diabetes. His immunity is less, body resistance is less. So immediately the web space gets fungal infection. Under that web space is a artery, that is a blood vessel which supplies to the adjoining toes. And if it gets blocked, suddenly you get a gangrene of the toes. The simple precaution every day morning to wash the feet, clean them, wipe the web spaces with a sanitizer or a spirit. Same thing to be repeated at night. Never walk barefoot. If you are walking in a rains barefoot, you not only the foot will become wet, but it is also likely to uh, get hurt because of so many things lying on the uh, floor of the road, or some obstacles, stones. There are nails there. So these are the things which have to be avoided. So always walk with a proper diabetic sandals. These sandals are made specifically for diabetic patient, which has no metal studdings. There are only overlapping strap to prevent the leg from coming out, or the edema can be, or swelling can be adjusted. And it is very important that these sandals have to be used. The commonest questions patient ask is that in the monsoon the sandals will become wet. Now even the sandals with a different material which will not cause problem into the foot when becomes sandal becomes wet are available in most of the major cities. So it is important to use these sandals and carry the separate set of socks. Similarly, when you have a neuropathy, usually the problem is that the nails become deformed, they become very hard, sometimes brittle, and they get stuck into the socks. And when you remove the socks, the nails get torn, and then it is a problem that causes a wound. So that's why you need to trim the nails. If the patient is old, he has a eye problem, somebody from the family or attendant has to trim the nails. And these nails should be trimmed once in a 15 days after bath, because then the nails are moist. The way to cut the nails is you have to cut straight and not slanting as it is done in most of the beauty parlors, because in diabetic with a neuropathy, when these nails are cut slanting, they turn inside and cause what is known as an ingrowing toenail, which requires surgery. And even with a nerve damage, it is extremely painful in a diabetic patients. And if there is a sharp edges, you can file those edges with a nail file. This is very important again, because if the nails are not cut properly, a nail fold remains wet, then it is going to cause infection. So when you clean the web spaces, you need to clean the nail fold also with a sanitizer and keep it moisture free. Similarly, if you have any con, which commonly occurs in diabetes because patients are walking barefoot, such a con's commonest uh, you know feeling or immediate impulse of a patient is to apply corn cap. Remember, corn cap have a acid, salicylic acid in that, and these patients have a skin which is neuropathic. That means the skin is very sensitive to any sort of a chemical. Because patient doesn't get pain, he applies corn cap, and that corn cap can cause the burns. So these corns occur because of the uh, shape of the foot keeps on changing when nerves are not functioning, and that causes the pressure points in the sole. So you have to get your feet examined once in a year, find out the pressure point either by examination or by sophisticated technology like a foot scan, and protect those pressure points with a proper footwear. Footwear is a very, very important to prevent the foot problems in diabetes. No medicine or no dressing will help unless you have a footwear which prevents the pressure on the pressure points. And these pressure points occur in each and every diabetic patient. Some may get early, some may get later, depending upon the progress of a nerve damage. And nerve damage progress is dependent on the blood sugar control. If you have a HbA1c, which is a 3 month test which has to be done to find out the status of a blood sugar control, which is above 7 or 7.5, that is a sign that your nerves have started getting damaged. So that is time you need to do a further sophisticated test for the nerve function. Meet your doctor or his paramedic who is trained to assess the foot, and also simultaneously check the circulation of the foot. So this is something which is regularly have to be done. So most of the patients check their eyes, they check their heart function, they took ECG, they check their kidney function, but foot is something which is not usually checked by patients and even many doctors, family physicians in outside metro cities, and that is the problem which patient has to face later on, because there is no assessment and suddenly patient gets the injury. So monsoon is the season where foot is at risk because it remains wet, and patients who travel in the buses, crowded trains, flooded roads have to take extreme care after reaching the office or any place where they're going to change the socks and use always the shoes which have a monsoon protection. And at night when you reach home, you need to wash the feet and see 4 or 5 things: whether there is any wetness, moisture between the toes, is there any injury, are the nails avulsed or their nails are loose, and if there is any blister. If because of the wet skin, many times it can cause the blister on the plantar or top of the foot, and in that case you need to meet your doctor get it corrected, and take rest. Never walk on the foot which has a blister or the wound. Rest is the most important. Whatever medicine you take, whatever injections you take, or however good your diabetes control, if you walk on the wounds, wounds are not likely to heal. Because normal person, when he gets a small blister, he will get a burning pain or some sort of uncomfortable sensation. That sensation is lost in diabetes because of a damage to the nerves. So if the patient keeps on walking on that and doesn't take care, then it is going to be a problem. Many patients who have a vision problem, or what we call retinopathy, cannot see their sole of their feet. So they need to be seen by somebody at home or some attendant every day evening to see whether there is a foot has any infection, there is any web space infection, there is any blister, there is any bleeding because of avulsed nails. So all this is a day-to-day care. And as I said, I would like to repeat again that never walk barefoot in the house. Every time a patient who has more than 3 to 4 years diabetes must have a socks in his foot and a proper diabetic footwear. Footwear is very, very essential to protect the feet. There is no medicine, there is no technology which can prevent the ulcers. If the patient is walking barefoot, he will be always exposed. See, another thing which happens in our country is that many patients go to the temple, they go to the mosques, other religious places, religious functions, where footwear is not allowed, and they have to walk barefoot. That's a very risky thing. So now in most of the major cities we have special socks, padded socks with a silicone layer, what we call a temple socks. So these are very important. Patients go on a pilgrimage, they go for like in a Pandharpur Wari or Sabrimala or many other pilgrimage. So there they walk barefoot. So that has to be avoided. Even in monsoon and otherwise, they can simply wear these temple socks, and that can protect their feet. And that's very essential because any injury will never again heal. But most important, regularly check your feet. If you find anything, go to the doctor. The family physician must once in a year at least check the nerve function, blood vessels, and the muscle function of the foot and document it. And every year this has to be done. If you find there is any problem, then it has to be done every 6 months or every 3 months, depending upon the severity of the problem. And those patients who don't undergo this test are facing a lot of serious problems, and they can land up in a problem at the end, and then it becomes very unmanageable. Many patients land up with an amputation. I would just like to quote you one of the recent statistics which was disclosed in American Diabetic Association meeting held in June in America, where they said that in America itself, every 4 minutes there is a amputation of the leg because of a diabetes. Unfortunately, we don't have any statistics and data like this. But considering our country, the population, the type of facilities which are there outside major cities, one cannot estimate how much loss of legs is happening in diabetic patients. So it's also important to protect the feet, walkable feet, because most of these patients who are there, 100 million, almost more than 50% of them are in an age group of 35 to 50, which is a very productive age economically for the patient, family, and as well as the society. And almost again, most of the statistics, national, international source, if the patient loses the leg at young age or later also, his survival is very less. The mortality is 85% at the end of 5 years if one leg is lost. If the patient has a kidney problem and he loses the leg, there is almost 90% mortality at the end of 5 years. So it's not only the leg patient loses, but he can lose the life. It will make his family suffer, and it's ultimately a loss to the society. A young person, working patient, loses the life because of neglect of the feet and non-examination of the feet, non-assessment of the nerve function, non-assessment of the blood vessel function can lead to all these things. It is also important to know, and I would like to stress this, is that many people and many family physicians feel a small foot ulcer is a very innocuous thing, but that's not innocuous. Most of again statistics world over shows that an ulcer of the foot, which is because of a nerve damage, has a mortality higher than a breast cancer, prostate cancer, and Hodgkin's lymphoma. And the ulcer, which occurs along with nerve function and a poor blood flow, has a mortality only third after lung and pancreatic cancer. So it's not, uh, the size of the ulcer. What damage it causes to the whole metabolism, whole system is very important. And many patients who don't get pain keep on walking, get infected, get undergo amputation and die. So I would like to end by saying we must remember that India has a tradition of foot care and footwear right from ancient times. And if you go to the South Indian cities, or especially taluk or small places, you still find people before entering the house wash their feet and go in. So it may be just a cultural act of washing, but the foot gets clean. So that is something we must remember, our ancient tradition. We need to reinvent in a modern time, because cleaning the foot daily, taking care of the foot, not walking barefoot, wearing proper footwear is the only solution to save the foot and prevent the amputation and ultimately prevent the deaths which occur in a younger patients. As of today, with whatever little statistics, which is very inadequate and it may not be correct, shows that more than 2 lakh people lose their limbs every year in India. As I told you, in American cities, the incidence is very high, but we may be having more, but we have no statistics. So it is my plea is that every patient of diabetes must undergo regular once a year foot examination, daily foot care, and always walk with proper socks and proper sandals. Then only you can be all right walking throughout the life in spite of having multiple problems. Thank you.